Rapelang Hadebe is our correspondent in Lesotho, and he joins me now via Skype from Ladybrand in the Free State. Rapelang, thanks very much indeed for joining us. This dispute is said to go back as far as 2012. How come it hasn't been resolved almost 9 years later?
Yeah, Peter, thanks to be with you again. It's really an embarrassment, you know. Tsepong Queen Mamohato Memorial was named after the queen of the second, King Moshoeshoe II, the biggest flagship triple P partnership, private-public partnership. It's a group of doctors or health professionals. It is the government and it is the Netcare South Africa. When it arrived, it was the flagship project. It was the highest paying. Every health professional's dream was to go and work there. But somehow, for the past 10 years, when they wanted to restructure the salaries, it looks like they have been hitting a brickstone. They've been hitting a bump after a bump. Every minister promises to come and get into it and solve it, but it never gets solved. There has been strikes, police brutality at its worst. But today, I think following what COVID has done, the health workers simply said, no, enough is enough. I spoke to the minister, who was very quickly to be dismissive and said, really, the issue of Tsepong is between the employer and the employee. Him as a partner, as one of the largest shareholder in the hospital, really does not seem to be attacking this issue as it should. You should remember, Tsepong alone takes close to a third of the fiscal budget of the health ministry alone, and a huge chunk of that budget goes to Tsepong alone. So for him to really say he cannot get involved between the employer-employee relationship is another thing. And when you talk to Netcare, who is the manager of the facility, he simply does not see it as an issue as yet.
All right. I mean, what it sounds like is that it's inevitable that service delivery will be affected. How has that been affected as a result of the hospital system under threat in the middle of a pandemic?
Indeed. I think after when the police really kicked them out from a peaceful protest, they are claiming that close to 80% of their manpower was out of the hospital. That means you are left with, it's not even a structural structure because the health workers are already stretched out. But I think in the next clip, we can listen to a group of doctors who, they call them a coalition of health professionals, who came together trying to understand, saying, you can be a doctor, but without this extra help that comes into, that's what completes the picture. And they're saying they're simply devastated because they have been called, most of them, to Lesotho to come back and serve the country. But when you get there, it's like nobody takes care anymore. Everybody just lets you to it. They don't understand how the issue of close to 10 years cannot be solved as yet. Maybe let's listen to the next clip.
I think our government doesn't consider health system as essential as they say it is, because I think they take a long time to address the issues that comes from this essential service that they say essential service is. But I'm pleading now that from this, I'm hopeful, I'm praying, I'm pleading that at least this time around, they need to change the way they see things.
My intention is to stay, but then though my intention is to stay, it will depend on whether the circumstances and the situations will allow that good intentions that I have. Because at some point you will have good intentions, but find some hindrances on the way. So that's why there is an English word that says, never say never.
Can you please come to work? Your patients need you, your colleagues. We had an employee who gave birth to twins prematurely. You went there to assist her, and she's in neonatal ward when she should be in NICU. So such things are really heartbreaking. We need you, the nation needs you. Please come back. Your plea is pertinent. It's very loud, and everybody hears. This has been an injustice.
Yeah, It cannot be explained beyond that. I think for the first time, this is when you really get to hear that even some who have been playing slightly arrogant have been coming to the table because they understand and they can now see that without all hands on deck, especially in the time of COVID, the biggest referral hospital cannot simply function. It has become a ghost town. A lot of people go into the facility and really are struggling. There's not enough time. I've had other interviews of people who came and said, people simply ignore you and tell you to come after some time. The morale is so low.